James Thomas, Morning Blend. We're doing a series with Care STL Health. Today I have Dr. Grimes here,
Yes,
and we're going to be
thank you.
talking about nurses, crisis. Is that right?
That is correct.
Definitely. So tell us about your department and what you handle.
So the nursing department at CareSTL Health is instrumental to the functionality of patient care. We are the backbone, per se, to the providers. We make sure that the providers have what they need in order to service our patients. By service, I mean take care of our patients. The nursing staff do more than just support the providers. They take care of our patients. They do labs if need be. They do referrals. So we do a lot. It's not a one-stop shop. We do a lot of things.
Dr. Grimes, talk a little bit about the nursing crisis as far as the lack of nurses in healthcare.
Well, the nursing crisis has been going on for years, and it's significant. It's increased since COVID. We've had over 100,000 nurses leave the healthcare field since 2001 to now. That's a significant number. We have baby boomers leaving. We have those are the ones that are aging out of healthcare. But the good thing is the people that are still here on the forefront, the ones that are still actively taking care of our patients, those are the ones that we have to focus on. We have to make sure that they stay in the healthcare field. And that's what we're looking to do. We're looking to make sure we can take care of all the patients that are out there, any patient that wants to see us, and we try not to let the healthcare shortage that we have in the nursing department affect how the patients are cared for.
Now, you've been doing it for 40 years, right?
Yeah, 40 plus.
Okay. So how do you get someone to go to nursing school? What's the incentive?
Well, there has to be the desire. You have to have the desire to want to be a nurse, to go into nursing. It has to be a passion there. I would say that if you want to be a nurse, have that passion, have that dedication to wanting to help. That's probably the biggest motivation that I would say to anyone. And then after that, I would say make sure that you pick a good program. Pick a program that fits your needs, the needs that you have in regards to where you want to go as a nurse or what type of nurse you want to be. Because in nursing, we have various levels. You can be a medical assistant, you can be a CNA, you can be a LPN, you can be an RN, you can be a nurse practitioner. So there's different levels. But as far as focusing on how to get someone to be a nurse or what we can do to get nursing, people to go into nursing, I would say empowerment.
I like that.
Empowerment.
I like that.
All right.
So the question again is, how has the crisis affected the nursing industry?
Well, it's affected the nursing industry in the fact that there are or can be longer wait times sometimes when a patient goes not just into a hospital but into a clinic or any healthcare setting. But that is industry-wide. That's not just for nursing. Because of COVID, we've lost over 100,000 nurses in the past 2 years. So that puts a great impact or strain on nursing. There's burnout. COVID caused a lot of mental stress and a lot of burnout in the healthcare field. And again, I have to generalize that because it's not just the nursing field that COVID caused burnout in. It's the world in general. So what we do is we try to make sure that we try to take some of that strain and eliminate some of that burden off of the nursing staff. We value those that are still here and that are still on the forefront fighting to make sure that the patients are taken care of.
Thank you. So Dr. Grimes, how do we fix this particular problem?
I don't think there's a long-term final solution. I think it's a progressive solution. So we have to first listen to concerns of the nurses when they're talking. I believe that we have to make sure that we're empowering the nursing staff. We have to make sure that schools are getting nursing students into schools timely and not having waiting lists. We have to make sure that we're hiring the right educators for the students, because when we don't have, we're short on educators as well to teach nursing students. So that's why a lot of the schools also have wait lists. So those are just some of the things that we can do, but most importantly, I think we have to be heard. And we have to let nurses be part of the intricate details and discussions when they're at the table. They need to be part of the people at the table.
Giving
when
them a
there's
voice.
Yeah, giving them a
Definitely.
voice when the decisions are being made.
Okay. Dr. Grimes, thank you so much for being with us and talking about your department here at
Right.
CARE STL Health.
You're so welcome.
Thank you.
Take care.